CNA 2024 exam. Question 1. Which of the following is the best way to prevent the spreading of germs? Hand washing before and after patient care, wearing a mask all day, using gloves for everything, taking vitamin C. The most effective method for infection control is consistent and thorough hand hygiene. Question 2. Which of the following is an example of subjective information? The patient's pain level is 7 out of 10. The patient's temperature is 98.6 degrees. The patient's skin is pink and dry. The patient's heart rate is 72 beats per minute. Subjective data consists of information reported by the patient that cannot be independently measured. Question 3. A resident asks if you will get help for a Hoyer lift transfer. What should you tell the patient? Yes, I will get another aide to help because your safety comes first. I can do it alone to save time. The lift is safe enough for one person. You don't need help because you are small. Safety protocols for equipment like Hoyer lifts must be followed strictly, regardless of time constraints. Question 4. What is the next step if a patient on a bowel regimen hasn't moved their bowels in 4 days? Report this to the charge nurse. Give the patient extra water. Wait 2 more days. Perform a digital stimulation. Changes in bowel habits or lack of results from a regimen must be reported to the supervising nurse for assessment. Question 5. Which item would you question on a lunch tray for a patient on strict dysphagia precautions? Regular orange juice, mashed potatoes, pureed carrots, thickened water. Thin liquids like regular orange juice are difficult to swallow for patients with dysphagia and pose a choking risk. Question 6. In what position is the bed when a patient is in the supine position? Flat, raised to 45 degrees, raised to 90 degrees, lowered at the feet. Supine position involves the patient lying flat on their back. Question 7. What is one reason why performing postmortem care is essential? It is crucial in maintaining the dignity and respect of the patient. It speeds up the room cleaning process. It is required by the insurance company. It prevents the patient from waking up. Postmortem care ensures the deceased patient is treated with dignity and prepared for viewing by the family. Question 8. How should you assist a resident who uses a cane during ambulation? Stand on the patient's weaker side. Stand on the patient's stronger side. Walk in front of the patient. Walk behind the patient. Standing on the weaker side provides the most support and safety during ambulation with an assistive device. Question 9. What do community activities and hobbies do for an elderly resident's outlook? Give a sense of purpose. Make them more tired at night. Increase their medical expenses. Allow them to ignore the nursing staff. Engagement in meaningful activities helps maintain mental health and a sense of value in elderly residents. Question 10. How should you respond if a patient asks about their roommate's cancer diagnosis? Explain that the roommate's health is confidential. Tell them everything you heard. Tell them the roommate is fine. Ask the roommate to tell them. HIPAA regulations require that all patient health information be kept confidential and not shared with other patients. Question 11. Which of the following happens when a patient has a stroke? The patient may have drooping on one side of the face. The patient will always have a high fever. The patient will lose their hearing. The patient will have a sudden rash. Facial drooping is a common clinical sign of a stroke and requires immediate medical attention. Question 12. What is important for the care of a diabetic patient's feet? Keep feet dry and warm with clean socks. Soak feet in hot water daily. Apply lotion between the toes. Let the patient walk barefoot. Proper foot care is essential for diabetics to prevent infections and complications due to poor circulation and neuropathy. Question 13. What should you do if a resident is hitting and kicking during care? Ask a second aide to get the nurse. Hit the resident back to defend yourself. Leave the resident alone for the rest of the day. Restrain the resident immediately. Escalating behavior or physical aggression should be managed by the nursing supervisor to ensure everyone's safety. Question 14. Why should you wipe from front to back during perineal care? To prevent bacteria from spreading to the urinary meatus. To make the cleaning process faster. To save on the number of wipes used. To keep the bed linens dry. Wiping front to back prevents the introduction of fecal bacteria into the urinary tract, reducing the risk of UTIs. Question 15. What is the next step after a blood pressure reading of 200/180 on a stable client? Check the cuff size and repeat the measurement. Call 911 immediately. Give the patient an aspirin. Tell the patient to exercise more. An unusually high reading should be verified with correct equipment sizing before reporting to ensure accuracy. Question 16. What should an aide do if they notice a resident screaming at a coworker? Call the charge nurse. Scream back at the resident. Ignore the situation. Record it for social media. Situations involving verbal aggression or conflict should be reported to the charge nurse for intervention. Question 17. What does eliminating wrinkles in bed sheets help prevent? Pressure sores, low blood pressure, infectious diseases, patient falls. Wrinkles in bed sheets create friction and pressure points that can lead to skin breakdown and pressure ulcers. Question 18. What condition is a 70-year-old patient likely experiencing with sudden cognitive delays and aggression? Urinary tract infection, normal aging process, a lack of sleep, food poisoning. Sudden confusion or behavioral changes in elderly patients are often a primary symptom of a urinary tract infection. Question 19. What should you do if a diabetic patient only finishes 25% of their meal? Report this to the nurse in charge. Force the patient to finish the rest. Throw the tray away and say nothing. Offer the patient a candy bar. Poor intake in diabetic patients must be reported as it directly affects blood sugar levels and medication timing. Question 20. What urine output amount in a 12-hour shift would be a cause for concern? 350 milliliters, 1,000 milliliters, 1,500 milliliters, 2,000 milliliters. Total urine output of 350 milliliters in 12 hours is below the expected minimum of 30 milliliters per hour and should be reported. Question 21. What should be included in the plan of care for a patient at the end of life? Ways to provide optimal comfort for the patient and family. A plan for intensive physical therapy. A new set of weight loss goals. Aggressive surgical interventions. Hospice and end-of-life care focus on palliative measures to ensure comfort and support for both the patient and loved ones. Question 22. What is the correct way to select the size of a blood pressure cuff? The width is about 40% of the arm circumference. The cuff should cover the entire upper arm. The cuff should be as thin as possible. The size does not matter as long as it velcros. A properly sized cuff width should cover about 40% of the arm's circumference for accurate readings. Question 23. What should a CNA do if a resident refuses to eat vegetables? Notify the nurse for a nutritional evaluation. Hide the vegetables in other food. Tell the resident they cannot have dessert. Ignore the refusal. Nutritional refusals should be documented and reported so that the dietary plan can be adjusted by the clinical team. Question 24. What condition is signaled by sleeping more, lack of interest, and withdrawal? Depression, excessive energy, improved health, a normal part of aging. These behavioral shifts are classic indicators of clinical depression in the elderly population. Question 25. Which intervention helps a CNA promote skin integrity? Pad bony prominences when in bed. Keep the patient in one position all day. Use harsh soaps for bathing. Keep the room very hot. Padding areas where bones are close to the skin reduces pressure and helps prevent the development of sores. Question 26. What is the rationale for repositioning a patient every 2 hours? To prevent skin breakdown. To keep the patient awake. To make the bed look neater. To increase the heart rate. Regular repositioning relieves pressure on vulnerable skin areas, preventing ischemia and breakdown. Question 27. What is the most accurate way to get a temperature for an infant? Rectally, axillary, orally, tympanic. Rectal temperature is considered the most accurate method for assessing core body temperature in infants. Question 28. What should a CNA do if asked to sign a resident's will? Decline and notify the nurse. Sign it quickly. Ask another resident to sign it. Charge the resident a fee. CNAs should not sign legal documents for residents due to potential conflicts of interest and facility policies. Question 29. What is the CPR compression to breath ratio for 2 rescuers? 30:2, 15:1, 5:1, 50:2. The standard compression to breath ratio for 2 rescuer CPR on an adult remains 30:2. Question 30. What is the next step if a resident cannot eat a tray due to religious beliefs? Take the tray out and contact the nurse for a replacement. Tell the resident they must eat what is served. Ask the resident to pick around the items. Tell the resident to wait until tomorrow. Respecting religious dietary needs is part of providing person-centered care and maintaining patient rights. Question 31. How do you ensure a Foley catheter is not pulled out during turning? Secure the catheter to the inner thigh. Tape the catheter to the bed rail. Leave the catheter loose. Hang the bag above the bladder. Securing the catheter prevents accidental pulling or tension that could cause injury or displacement. Question 32. What is a bed-bound patient at risk for? Atrophy, increased muscle mass, better circulation, faster metabolism. Lack of movement leads to muscle wasting and weakness, known as atrophy. Question 33. What should a CNA do upon finding unlabeled pills in a nightstand? Notify the nurse immediately. Throw them in the trash. Give them to the resident. Put them in their own pocket. Unidentified medications are a safety hazard and must be managed by the nursing staff according to protocol. Question 34. What action should be taken first during a behavioral disturbance? Provide for patient and staff safety. Document the event in the chart. Call the resident's family. Give the resident a snack. The immediate priority in any behavioral crisis is ensuring the physical safety of the patient and the care team. Question 35. What does a patient likely have with a fever, high heart rate, and sweating? An infection, a cold chill, a normal reaction to exercise, hunger. Elevated temperature, pulse, and respiratory rate are systemic indicators of a possible infection. Question 36. What is the proper rate for adult CPR compressions? 100 to 120 compressions per minute, 60 to 80 compressions per minute, 140 to 160 compressions per minute, 20 to 40 compressions per minute. Effective CPR requires a high rate of compressions to maintain circulation during cardiac arrest. Question 37. What is the proper unit for measuring bodily fluids? Milliliters, ounces, pounds, inches. Healthcare facilities use the metric system, specifically milliliters, to record fluid intake and output. Question 38. What should a CNA do if a resident wants a copy of their medical records? Provide release forms and advise the supervisor. Hand them the original chart. Tell them they are not allowed to see it. Make copies at a local store. Patients have a right to their records, but the request must follow formal administrative procedures. Question 39. What is the next step if a nurse repeatedly gives a patient an allergen? Tell your nursing supervisor. Ignore it to avoid conflict. Tell the patient's roommate. Do nothing as it is the nurse's responsibility. Repeated safety violations or disregard for allergies must be reported up the chain of command for patient protection. Question 40. Where is the best location to take an apical pulse? The fifth intercostal space at the midclavicular line, on the wrist near the thumb, in the middle of the forehead, behind the knee. The apical pulse is most clearly heard at the apex of the heart, located at the fifth intercostal space. Question 41. What should a CNA do if two unmarried residents are cuddling? Allow them to enjoy each other's company. Separate them immediately. Report them for misconduct. Call their families to complain. Residents have the right to form relationships and express affection as long as it is consensual. Question 42. What should be incorporated into the care plan for a client on swallowing precautions? The client should not be left unattended while eating. The client should eat as fast as possible. The client should lie flat while eating. The client should only eat dry crackers. Supervision during meals is critical for stroke patients to prevent aspiration and manage choking risks. Question 43. What should be done when beginning to reposition a patient higher in bed? Lower the head of the bed. Raise the head of the bed to 90 degrees. Place the patient in a chair first. Remove all the pillows. Lowering the head of the bed reduces friction and makes it easier to slide the patient upward safely. Question 44. What is necessary for patients with stress incontinence? Frequent toileting breaks throughout the day. Limiting all fluid intake. A permanent catheter. Bed rest. Scheduled toileting helps manage incontinence by ensuring the bladder is emptied regularly. Question 45. What should a CNA do about a resident's pornographic magazine? Ask them to keep it in their room. Confiscate it immediately. Show it to other residents. Throw it in the trash. Residents have a right to personal possessions, but facility rules regarding public spaces must be respected. Question 46. What is the correct compression depth for adult CPR? 2 inches, 1 inch, 4 inches, half an inch. Chest compressions for adults should be at least 2 inches deep to effectively pump blood. Question 47. What items are included in contact precautions? Gloves and gown, mask and goggles only, shoe covers only, a respirator and hairnet. Gowns and gloves are standard personal protective equipment for patients on contact precautions. Question 48. How should you handle a family request to hide a diagnosis from a patient? Encourage the daughter to inform the patient of the diagnosis. Agree to hide the information. Tell the patient yourself immediately. Lie to the patient if they ask. Patients have a legal and ethical right to be informed about their own health status. Question 49. What is one of the best ways to respect a resident's decisions? Actively listen to the residents. Make all the choices for them. Ignore their requests. Tell them they are wrong. Active listening validates the resident's choices and fosters a respectful caregiving relationship. Question 50. What is the next step for a patient with fruity breath and low speech? Obtain a blood glucose measurement. Give them a glass of water. Tell them to take a nap. Apply a cold compress. Fruity breath is a sign of ketoacidosis, and blood sugar testing is critical to determine the severity of the metabolic state. Question 51. What should a CNA do when asked to help a resident up from the floor? Help report the event to a supervisor. Lift them up and say nothing. Leave them there until the doctor arrives. Ask the resident to get up themselves. All falls or unwitnessed events involving a resident on the floor must be reported for investigation and assessment. Question 52. How should you respond to a resident refusing a shower for 3 days? Explain it is their right to refuse and try again later. Force the resident into the shower. Call the police. Tell the resident they smell bad. Respecting a resident's right to refuse care is fundamental to patient-centered nursing. Question 53. What is a patient with dark stools likely experiencing? A gastrointestinal bleed, a high-fiber diet, normal digestion, dehydration. Dark, tarry stools, melena, are a common sign of upper gastrointestinal bleeding. Question 54. What does a pulse oximeter measure? The amount of oxygen in the blood, the blood pressure, the body temperature, the respiratory rate. Pulse oximetry provides a non-invasive measurement of oxygen saturation in the bloodstream. Question 55. What is the next step for a patient with bruises in multiple stages of healing? Report possible abuse to the authorities. Apply ice to all the bruises. Ask the patient to be more careful. Ignore it as part of aging. Unexplained or patterned bruising requires reporting to external protective agencies to ensure patient safety. Question 56. What should a CNA do about a resident's sloppy room? Identify safety hazards and help relocate items. Throw away everything on the floor. Refuse to enter the room. Lock the door. Balancing resident autonomy with safety requires identifying hazards while respecting personal space. Question 57. What should a CNA do for a resident who wanders into other rooms at night? Provide companionship and supervision. Tie the resident to the bed. Lock the resident in their room. Give the resident a sedative. Supervision and social interaction can help redirect wandering behavior safely without using restraints. Question 58. What emotional need is met by call lights and fall prevention equipment? Safety and security, self-actualization, hunger and thirst, social status. Measures that prevent injury and ensure assistance is available promote a sense of security. Question 59. What should you say to a CNA who enters a room without knocking? Please knock for the resident's privacy. Get out of the room. Nothing at all. Tell the resident the other CNA is rude. Maintaining resident privacy and dignity is a core responsibility that must be advocated for among staff. Question 60. Which task would a CNA participate in during a shift? Assisting with bathing, prescribing medications, performing surgery, diagnosing a disease. Daily living activities like bathing are central to the role and responsibilities of a CNA.